Hello, my name is Rochi. We're going to be doing a head-to-toe assessment skills video for you today. So the first thing we're going to do to start this video up, we're going to go to our patient's room. We're going to close the door behind us to ensure patient privacy. The next thing we're going to want to do is perform hand hygiene and put on a new pair of gloves. Okay, the next thing we're going to be doing is introducing ourselves to the patient. Hello, sir. My name is Rochi. I'm going to be your nurse today. Is it okay if I do a head-to-toe assessment on you?
Yes, sir.
Okay. So the next thing we're going to do is check our patient's armband. Okay, sir. Can you tell me your first and last name as well as date of birth?
Patrick Smith, 120578.
Okay. So we've done our two patient identifiers to ensure that this is Mr. Smith that we're going to be doing our assessment on today. So Mr. Smith's general appearance, he seems to be well groomed. He seems calm and no acute distress at this time. So the next thing we're going to do is do Mr. Smith's vital signs. So we've done Mr. Smith's vital signs. His blood pressure is 118/78. His temperature is 98.6. His heart rate is 68. His respirations are 18, and his oxygen saturation is 99% on room air. So, Mr. Smith, on a scale of 0 to 10, 10 being the worst pain and 0 no pain, what's your pain level today?
0.
Okay. So we've established that Mr. Smith has 0 out of 10 on the pain scale. So Mr. Smith currently does not have any pain at this time. So, Mr. Smith, I'm going to be checking your hair and your scalp hair. So Mr. Smith's hair seems to be evenly distributed. There are no infestations. His scalp appears to be normal with no abnormalities. Okay, so the next thing we're going to want to do is check for hydration status. So Mr. Smith, I'm going to be checking your hand here, the back of your skin on your hand. So I'm going to pinch it a little bit slightly. So by doing this, I can check the skin turgor of the patient. So there doesn't appear to be any tinting going on with his patient's skin, so he appears to be well hydrated. Mr. Smith, I'm going to be checking your skin now. Can you lean forward for me?
Mm-hmm.
Okay, lean back for me. Check your arms. Okay. Okay. Check your legs. Okay. After doing Mr. Smith's skin assessment, we've assessed that the patient does not have any skin breakdown anywhere on any of his bony prominences. Skin is warm, dry, and intact. No scratches, no ulcers, no skin issues going on at this time. So the next thing we're going to want to do is check Mr. Smith's eyes. So Mr. Smith's eyes appear to be symmetrical. Mr. Smith, I'm going to be shining a light in your eye if you look straight forward for me. Okay, Mr. Smith, I'm going to pull down your eyelids a little bit. Mr. Smith's sclerae appear to be white. Okay, Mr. Smith, I'm going to ask you to look at the top of my pen light and then look at the fan. Look at the top of the pen light. Look at the fan. One more time. Okay. So it appears Mr. Smith, after doing the assessment, his pupils are equal, round, and reactive to light and accommodation. So the next thing we're going to want to do is check Mr. Smith's nares here. Okay, Mr. Smith's going to shine a nose in your, I'm going to shine a light in your nose. Can you lean your back a little bit? Okay, Mr. Smith's nares appear to be moist and intact. His septum is midline. Mr. Smith, I'm going to palpate your sinuses here. Okay. Mr. Smith's sinuses appear to be not swollen or inflamed at this time. and patient does not have any pain around the sinuses. So the next thing we're going to want to do is check Mr. Smith's lips. Okay, Mr. Smith's lips appear moist and intact. Oh, and before we go on, we're going to also, Mr. Smith, can you touch one of your nostrils and close it with your finger? Okay, breathe. Okay, and do that with the other nostril, please. Okay. Mr. Smith's, after doing this, we're assessing that Mr. Smith's nares are patent at this time. So we'll be moving back onto the mouth now. Okay, Mr. Smith, if you could open your mouth for me. I'm just going to shine a light here. Okay. Mr. Smith's teeth appear to be intact. Mr. Smith's oral and buccal mucosa seem to be also moist and intact as well. And his palate is upwardly movable. So the next thing we'll be doing is his ears. Okay, sir. Okay, Mr. Smith's ears appear to be normal. There is no drainage noted. We're going to be now palpating Mr. Smith's neck and his lymph node for his lymph nodes. Okay, Mr. Smith, I'm going to touch your neck here a little bit. Okay, Mr. Smith's trachea appears midline, and also Mr. Smith's his lymph nodes do not appear swollen or inflamed at this time. We're going to check now, Mr. Smith, here for jugular vein distension. Okay, there's no jugular vein distension noted on Mr. Smith at this time. So, Mr. Smith, can you move your head up and down for me and left to right? Okay, we've assessed that Mr. Smith has good range of motion in his neck. So, Mr. Smith, I'm going to be checking your lung sounds now. So I just want you to breathe normally for me when I listen to it. Can you leave for me, sir? Okay, lean back for me. So after assessing Mr. Smith's lung sounds, his lung sounds appear to be clear to auscultation on all lobes. There are no adventitious breath sounds noted at this time. So the next thing we're going to want to do is check Mr. Smith's heart sounds. Okay, Mr. Smith's heart sounds appear to be regular rate and rhythm at this time. So the next thing we're going to want to do is assess Mr. Smith's pulses. So we're going to assess Mr. Smith's radial pulses here. Okay, the next thing we're going to do is assess his dorsal pedal pulses. Okay, and it appears Mr. Smith's pulses in his radial and dorsal pedal pulses are 2+ bilaterally. So the next thing you're going to want to do is assess Mr. Smith's capillary refill. So by doing this, I'm going to press on your nail here, Mr. Smith, for a little bit. Okay. We're also going to be checking capillary refill on his toes as well. Okay. So after doing this, we've assessed that Mr. Smith's capillary refill on his upper and lower extremities are less than 3 seconds, so that is good. So the next thing we're going to want to do is check we're going to move on to Mr. Smith's abdomen. Okay, Mr. Smith, I'm also going to palpate your abdomen here a little bit. Let me know if you have any pain. Okay, after doing this, we've listened to our patient's bowel sounds. We've also palpated his abdomen. His bowel sounds are active in all 4 quadrants, and his abdomen is soft and non-tender. So the next thing we're going to do is, Mr. Smith, when was your last bowel movement?
This morning.
Okay, so if it says there Mr. Smith's last bowel movement was this morning, any trouble urinating at all?
No.
Okay. So the next thing we're going to do, we're going to assess Mr. Smith's range of motion. So Mr. Smith, can you sit at the side of the bed for me? Thank you, sir. Okay, Mr. Smith, can you raise your arms for me? Then to the side, and then circular motion. Okay. Next thing you want to do, Mr. Smith, can you close your arms like this? Okay, I'm going to push against it. Try not to let me do that. Okay, you stretch your arms. So after doing this, Mr. Smith's range of motion, he has full range of motion in his upper extremities. He has good strength. Okay, Mr. Smith, can you extend your legs out for me? Sorry. Extend your legs out for me. Okay, I'm going to try to push down, okay? Okay, now move your feet, circular motion, up and down. Okay, I'm going to push down too again, okay? Okay. So after doing this, we've assessed that Mr. Smith's lower extremities, he has good range of motion as well in his legs, as well as in his ankles. He has good strength. Okay, Mr. Smith, can you stand up for me? Okay, now Mr. Smith, can you bend down and touch your toes? Okay, come up, please. Okay, I'm going to push on your chest, Mr. Smith. Don't let me, okay? Okay, go ahead and sit down, Mr. Smith. So after doing this, we've assessed that Mr. Smith has full range of motion in his back. He has good strength. Okay, Mr. Smith, I'm going to have you stand up for me. And can you walk around, take a couple steps around here, around the bed? Okay, turn here. A little bit more. Okay, Mr. Smith, you can come back and sit down. So we've assessed Mr. Smith's gait. He has full balance. He has good balance, good strength, good center of gravity. So he's ambulating well. The next thing we're going to do, Mr. Smith, I've already asked some of these questions before. This is going to be assessing Mr. Smith's neuro status. So, Mr. Smith, can you tell me your first and last name again?
Patrick Smith.
Okay. Mr. Smith, do you know where you are right now?
Hospital.
Okay. And what month are we in, Mr. Smith?
March.
Okay. So after doing this, we've assessed Mr. Smith is alert and oriented ×3. So the next thing we will be doing is at this time we've assessed that Mr. Smith is alert and oriented ×3. So the next thing we'd want to do is if we would do any patient teaching, if we were to do that before we leave, we would ask Mr. Smith if he was comfortable, safe. We would have the call light in reach. So Mr. Smith, after we're done, you can go back and lay down in the bed, or you can sit here, it's up to you. So after this, I will remove my gloves. I will dispose of them properly. I will perform hand hygiene again. Again, I will make sure my patient is safe before I leave his room. I will document all my findings in the assessment, and we are done.